Hello, hello. Sleep. What do you guys know about sleep? When a cup of warm milk is not enough, sleep. Okay. Hello there. My name is Randy Silverman. I am a certified sleep coach and the creator of Stressed to Zen, which is a home study course. It is delivered via your email for 10 days. And also the creator of the Sleep Habit Solution, which is a 12-week sleep program which focuses on nutrition, your sleep habits, and your mindset for overall wellness. So this video is going to be based on sleep and when a cup of milk is not enough. Okay, what is normal sleep? Normal sleep patterns, which are the cycle, as there are 4 stages of sleep: non-REM, that is a non-rapid eye movement, and circadian rhythm, and drugs that influences sleep, and genetics of sleep. Sometimes your genetics has a role in how well you sleep or don't sleep. The status of Americans on overall sleep. Well, 62% say they experience sleep problems many times a week or more. Okay, 40% sleep enough during the day to interfere with activities. Actually, so when they're doing something and they feel sleepy and interferes whatever they are doing. 62% drive while drowsy. Can you imagine that? Can you imagine driving and you feel sleepy? So over 100,000 of accidents are caused by drowsiness. People that are sleepy, why don't you just pull off on the side of the road and get some Z's? Just close your eyes, right? 27% of those people have fallen asleep while driving. That's pretty scary. 60% of children feel that their parents are tired during the day. 15% of children admit falling asleep at school. So what can we do to curb this? Get your Z's. Why not take naps? We always find time to watch TV, right? Am I right? Give me a thumbs up if you agree. We always find time to watch TV. But what about getting your sleep? Sleep can have an effect on your health. It can even have an effect on your life. So that is a food for thought. Status of men with sleep. On weekdays, 1/3 of men get less than 6 hours of sleep. 47% of truck drivers report falling asleep at the wheel. That's pretty scary. Just pull off on the side of the road for a few minutes, a half hour. Now, set your timer on your phone. We're always on our phone, seeing who's chatting us, right? Set your timer for a half hour or an hour and get some sleep. And then you can carry on with your driving or your route, right? OSHA, okay, that is the cost of being driving, the cost of being drowsy while sleeping. $2,720 a year undiagnosed, but costs $1,384 a year if diagnosed and treated for being tired. Overall additional cost of OSA in the U.S. is $3.4 billion. African American men have a higher risk of OSA. Okay, now since we talk about men, what about women? The status of women and sleep. 79% report sleep disturbances during pregnancy. 36% of women, perimenopausal women, report disturbed sleep. 30% disturbed sleep interferes with daily activities. So since you see that there are many things that go on while we are tired, we can just curb the statistics and get your sleep. If you are wondering and you want to join others, you can join my group, Women Who Can't Sleep Support Group. I will post that link in this video. And if you want to chat with me, you can make a comment on this. Normal sleep normal sleep cycles are your non-REM, your non-rapid eye movements, and your rapid eye movements, and also the circadian rhythm. The drugs also influences your sleep, and genetics also can influence your sleep. Insomnia, what is insomnia? Insomnia is the difficulty of initiating sleep. You have trouble going to sleep. You awaken frequent when you are supposed to be sleeping, and it also includes early morning awakenings, and it's also a subjective feeling of insufficient sleep. That is insomnia. And the causes of insomnia are short-term insomnia, change in sleep environments. Of course, if you're away, if you're going on vacation, of course you might not want to sleep because maybe you're excited, you're in a different room, a different bed, whatever the case may be. Jet lag, changes in work shift, excessive noise, unpleasant room temperature. The ideal temperature of the room when you sleep should be around 63 to 67 degrees. The cooler, the better. Unpleasant room temperature, stressful life events, and medical condition. Of course, if you're going through some medical condition, that can have an effect on your sleep too. Chronic insomnia are anxiety, schizophrenia, depression, learned insomnia, insufficient sleep, poor sleep hygiene. Hygiene has to do with the things you do or don't do before you go to sleep. Focus on what you eat or don't eat, physical activity, whether you get it or you don't get it, your mindset. Your mind plays a huge role on whether you get to sleep and stay asleep. Maybe some of you have fear that awaken you while you're sleeping, so you get up and you're scared. Restless leg syndrome plays a role in your sleep. Circadian rhythm plays a role also. The treatment of all this, the non-pharmacologic treatment, is your sleep hygiene, relaxation techniques, yoga plays a role, meditation, I'm all for that. I have some meditation clips for you. If you're interested, you can type yes, I'm interested in this video. Sleep restriction, pharmacologic therapy. Those are the drugs that can help with sleep. Melatonin, antihistamines, antidepressants, and light also plays a role. Other sleep disorders are narcolepsy, genetic aspects of narcolepsy, diagnosis, treatment of narcolepsy are stimulants, suppressants, behavioral adjustments. Alrighty, moving right along. Another sleep disorder is sleep apnea. Sleep apnea, what is it? It is a disorder of breathing and sleep. Obstructive sleep apnea is your airway actually closes while you're sleeping, and then you actually take a breath, and then you're not breathing for a second, a minute. Okay, central sleep apnea, a restrictive lung disease, neuromuscular disease, and cardiac and neurological. Those are sleep apnea. Actually, sleep apnea is one of the most serious sleep disorders, and you should get yourself checked through your doctor and see if you can get treated. Moving along, parasomnias are sleep terrors and sleepwalking. These are people actually sleep while they walk. They usually have central nervous system, which is a disease of parasomnias, that's sleep, and cardiac disease can also trigger this. Moving right along with that, we have disrupted sleep or Parkinsonism. That is a kind of sleep disorder. Neuromuscular disease, respiratory disease, dementia, epileptic seizures can disrupt your sleep. So as I mentioned before, I am a certified sleep coach. You can join my group. I have many people in my group, and we share our sleep struggles. So I will put that link in this video. And until then, you can look at my other videos on here. I have done many, and I will do more. Okay, until then, have a wonderful day. Bye.